talking to you about sickle cell disease, Sam, had you ever seen these products, this technology being used with sickle cell disease?
You know, the first generation of Ace Mannin, I think we tried and saw marginal results.
I see.
But the newest generation that has about 4 to 5 times more immune activating fractions of Ace Mannin per gram,
Yeah.
it could have been just a dosage thing. But now, all of a sudden, we're seeing the response that we saw in the pilot.
And that's probably because we had a big pool to tap into. But back home,
Right.
like I was telling you, how we were just focused on brain disorders. Our foundation is called the Brain and Body Foundation, and we were just dealing with cerebral palsy, autisms, epilepsies, and all that, because we have a
Right.
lot of those back home. Because once you don't have proper medical care at the time of birth, a lot of things can go wrong, and it starts with the brain. A lot of things go wrong starting with the brain, and so we had a lot of that going on. And in the process of people coming to our foundation, we just started having people come in with strokes, children with sickle cell disease, 8, 9, 10, 11, 12 years of age, coming with on wheelchairs, having suffered multiple strokes from sickle cell disease. And I was like, this is crazy. Why would this still be happening? I mean, I thought, well, last time I treated a child with sickle cell disease was when I was in medical school. So it was just bizarre. So we started looking into it. And then we just found out that amongst the weaknesses that children have with sickle cell disease is a weak immune system.
Sure.
And that's when I was like, hey, Sam, come on.
Maybe we should try this.
Maybe we should try this.
Couldn't hurt.
It couldn't hurt, absolutely. And that's the good thing about it. It doesn't cause any toxicity or anything like that. But here's the problem. Modern medicine or conventional medicine focuses on that tiny bit. Okay, the problem with sickle cell disease is that the red blood cells are turning sickle shaped.
Sure.
Let's study this red blood cell. Let's focus on this red blood cell and see how we can prevent this cell from turning from a round looking cell to a sickle shaped cell. That's where all the research is going. Let's focus on that little red blood cell. Not realizing that there's a lot more to the picture. And so we know that the platelets are affected in sickle cell disease. We know the red blood cells are affected in sickle cell disease.
Right.
We know the white blood cells, in other words, aka
system.
the immune system, is affected in sickle cell disease. And simply by strengthening one of the things that are affected in sickle cell disease, we've been able to see that, yes, it will help the red blood cell as well. And if you're a doctor here listening, we're not trying to tell you this is not the way to treat sickle cell disease or anything. We're saying, in addition to whatever you're doing for a child with sickle cell disease, you need to consider strengthening the immune system as well. We're certainly not saying that there's only one product that can do it, but we do know that this product strengthens the immune system. If you can get anything else that helps strengthen the immune system, good luck to you, and we certainly want you to do that. You don't have to get this particular product from Manna Relief Ministries. What we want to do is to establish the fact that strengthening the immune system can go a long way towards improving the quality of health of your patients.
It's actually a pretty significant movement in medicine today. It's called integrative health.
Absolutely.
You take standard of care therapies, you add a component to it to enhance the patient outcome. In our case, you add a component that supports their immune function, the basic, functions of repair and regeneration. And no matter what the therapy is, this has no interference with it whatsoever. And what you get is a better patient outcome.
I'll have to correct you on that, Sam, if I may. It does interfere with it. It does interfere with the treatment. It interferes by making the treatment even better, by improving.
I mean, there's no negative.
Negative. Okay.
Yeah, that's right.
We'll take that.
Interference, exactly. Because a lot of times that's a legitimate question. Herbs, for instance, have drug-like chemicals in them.
True.
And those drug-like chemicals can act in a negative way in drug interactions. But Ace Mannin is a polysaccharide.
It's in mother's milk.
It's in mother's milk, exactly.
So
Same structure.
Unless you're allergic to mother's milk, and we'll have to ask your mother about that.
That's right.
It's unlikely that you'll be allergic to this. So please consider this. We thank you for listening, and we'll continue to share I'm sorry, Sam. Did we finish?
I'm finished, yeah.
Okay. I should ask first. All right. We encourage you to follow our journey. We'll be sending out videos and images and words on sickle cell disease. We want to. Our goal is to drastically reduce the suffering of
Right.
children with sickle cell disease, not only in Nigeria, not only in Africa, in the U.S. and around the world, because
Right.
we owe it to them. They should not be suffering in the 21st century like this. So stay tuned and thank you for listening. God bless.
Thank you.
And thank you, Sam.
Yeah,
I
thanks,
appreciate the time.
Appreciate it.